my name is Andrea Sheely, and we are in week 2. We are on part D, and we're talking about different assessments that can be used with children. So the first question reads, what are some pediatric evaluation tools that you are already familiar with? Name at least 3 and describe what they are. So I will have to use my notes a little bit more just because I'm not as familiar with pediatrics, but some of the assessments we've talked about include the Hawaii Early Learning Profile, the Bailey Scale of Infant Development, and the Miller Assessment for preschoolers. So for the Hawaii Early Development, that is used from children from birth to age 3, and it evaluates skills in 6 different developmental categories, including language, fine motor, gross motor, social skills, self-help, and cognitive skills. This kind of provides a clear picture of where the child is at, and then it kind of helps to communicate to the parent, okay, this is where your child is, and this is where we need to work in these certain areas. Then the Bailey Scale of Infant Development can be used on children from ages 1 month to 42 months, and it helps to identify disabilities and concerns in children as young as possible to begin the intervention techniques. It really is an assessment used to identify these developmental competencies, so making sure that at the appropriate month the child is able to do the various check-off lists, basically, like are they laying prone on their stomach, are they able to roll over in the appropriate timing, those sort of things. The next assessment, the Miller's Assessment for preschoolers, is also known as the MAP. It evaluates the developmental status of the preschooler, and it works on like a mild to moderate disability level. Anything over the moderate, it kind of is not as successful with determining what the exact level is, but it includes areas like cognitive ability, sensory, and motor abilities. And this kind of helps the practitioner to establish what are the child's strengths and what are the weaknesses, what do we need to be working on. So the next question reads, identify the different pediatric settings that exist and compare and contrast the different settings. So we have our acute care hospital. This is where clients who may have had an accident or they're going through things like cancer, radiation, those sort of things. Private outpatient clinics. So this is a setting where the parent is going to bring the child in for occupational therapy treatment. You might be working on fine motor skills, gross motor skills, socialization skills, but the child will go home with the parent afterwards. The next setting is the school setting. So this is where children from preschool up until they graduate, but oftentimes more of that elementary age, are looking at things like handwriting, coloring, cutting. So they will also have an IEP attached to their occupational therapy services. The therapist will come in for an allotted set scheduled time, approximately like 30 minutes, and you just work on those goals. For school really related activities, like I said, writing, coloring, cutting. The next setting is the home health. This is where the therapist is going to come into the child's home. This occurs when the child is younger, newborn up until they kind of go to preschool. Once they go to preschool, the school setting kind of takes over their goals. Here you might be working on, once again, fine motor, gross motor, self-care things. A lot of times the children are a little bit too young for too much self-care, but if it's appropriate, it could definitely be worked on in this home health setting. Like, for example, toileting and a potty schedule. And then finally, a community outreach program. This is going to be more for the children who maybe don't have insurance and they qualify under Medicaid, or the child needs to benefit from like social participation skills, the child would be brought into this community program, but it's not somewhere where they would stay or live. They would be treated during this community outreach program, and then they would return home. So the final question reads, identify at least 2 different assessments that would be appropriate in all the practice settings mentioned. So the first one is the Motor Free Visual Perception Test, the MVPT. It is a standardized test. That's why I picked it for all the settings, just making sure we have very accurate data that measures overall visual perception of the child. So we're going to be looking at the child's ability to perform visual memory, visual discrimination, spatial relations. The next one is the Peabody Development Motor Scale Tests. The Peabody is going to look at gross motor, fine motor, and compares them to the normative values of a child without a disability. It's going to look at specific assessment areas like locomotion, grasping, manipulation of objects, reflexes, stationary, and then visual motor integration. Thank you. Have a great day.